asking you to make a copy. So that means you will have one that you can distribute. There's clickable links in there, and that should make things easier to use. And for some reason, okay, there we go. Let's just go into this since I know we have a limited amount of time. So we're going to talk about the NIH Public Access Grant today. We're getting lots of questions about that here at UD, just to make sure that we're on the same page about what we're talking about. This is a result of the OSTP mandate that was released in August of 2022. And it means that if you are publishing results of research that was federally funded, it needs to be made immediately accessible with no embargo. You need to make the data available. And it also is trying to encourage the adoption of persistent identifiers as DOIs to make sure that those materials remain findable over time. And it charges funding agencies to create appropriate public access plans accordingly. And so they're all a little bit different. We are still waiting on the National Science Foundation. They still have not published one. And with the NIH, part of that public access plan is the need to make your research accessible on PubMed specifically. So the public access requirements apply to peer-reviewed materials only that have been accepted for publication on or after July 1st of this year. And if you happen to have a super old, long-running grant from before 2008, you don't need to worry about this. We have gotten some questions here at UD. An example is a professor was invited by a journal to provide a commentary based on the research that they are currently doing that's NIH funded. They approached us. Do I need to make sure that that commentary gets put up on PubMed? It's a commentary. It did not go through a peer review cycle. It just went through a simple copywriting editorial cycle. And so it did not need to be, it was not subject to this public access mandate. What is complicating this and driving a lot of questions is that the public access mandate, basically, you are granting a license to the federal funding agency to distribute your work, right? And so if you look at that information in the yellow box, this is kind of the crux of the issue and the area where we're getting all these questions. This is a prior agreement to your right, to your rights with the publication. So what it means is that you've granted the government a license to make your publication freely available on PubMed and to distribute it on PubMed. But this has nothing to do with your actual copyright. It is a license to post it. It doesn't do anything about your copyright. You still own all of your copyright in the work and your rights attendant to that, meaning your right to copy it, distribute it, republish it, make derivative works from it, all those things. You're simply agreeing to let the government make the work publicly available. The tricky part is that this license to the government takes precedent over the right of a publisher to do the same things with your work. And so a lot of the conflict that's going in right now is that a lot of publishers are saying, here's a way to monetize, further monetize publishing by saying, okay, great, you want to fulfill this mandate, we're going to charge you open access fees in order to help you meet the mandate. This is where it's getting complicated. So we're going to spend a little bit more time on that. And so to make sure that we're, once again, all on the same page, all of you who have published, understand that there's different phases that your article manuscript goes through. But what we're finding here at the library is not everyone quite understands the terminology that publishers use for it. So just to make sure that we're all on the same page, the published version, very clearly, that is the version of record. That is what was in the journal. That is the one that has the journal branding on it, the formatting, all those style things. It's been under peer review and it's all gone through the whole editorial process. That article, that version does not need to be put up on PubMed. What is acceptable on PubMed is what's called the accepted version or the author accepted manuscript. And so this is the kind of the squishy zone. This is when your article's been accepted for publication. It's been through the peer review process, but it hasn't gone through all just the final formatting stage, right? And then another version that we're really, all really familiar with is what you originally submit, right? And there are a lot of what we call preprint servers out there in the world. Archive is one of the big ones. There's biomedical ones, all that kind of stuff, where you can put preprints up. So that means articles that have not been put through peer review or any kind of editorial process. The preprint is not what the government wants you to put up on PubMed. They want something that has been vetted and gone through the peer review process. So we get a lot of questions of saying, well, can't I just put my preprint in wherever and it'll be publicly accessible? That will not meet the terms of the grant. It needs to be at least the author accepted version that has been through the peer review process. So to continue on with the requirements, that means PubMed. So the other question we get a lot is, well, can't I just put my article in the institutional repository? So at UD, that's UD space. Can I put it up on some other online repository that's used in my field? The only thing that will work for NIH is PubMed. And it has to be that thing. So then the other thing that we are handling a lot of questions about is the fees and publishing fees. They are expensive. Open access publishing is expensive. And so directly from the NIH, what you see in the little call out box is that fees that a journal might charge you just to put it on PubMed are not allowable costs for a grant. So I want to give you a very specific example. We got this question here at UD a few weeks ago. I'm going to call out this publisher by name because they have been terrible. So the American Chemical Society has added a unique charge on its publishing platform that says, oh, if you want to put your author accepted manuscript up on PubMed, you have to pay this fee. So the fee is less than they charge for open access by about $1,500, but it is still over $2,000 fee that they are charging people just to put it up on PubMed. That fee could not be paid and is specifically not allowed under PubMed or under NIH grant requirements. You could not pay that fee using your grant funds. So that's where a lot of questions come in. APCs or article processing charges are allowed and can be written into budgets, but they cannot be a fee that is only for the purpose of putting it up on PubMed. So if you want to publish open access, $3,000 charge for that open access and to make sure that it is immediately available and you can put a copy on PubMed. That is something that you could consider writing into grant funding. So that's just something to start thinking for the future as you do this. This cost principles link is guidance from the NIH about what to think about when you're thinking about what are allowable and not allowable costs. And there's a lot of different considerations that may come into that. Some of your obvious considerations would be publishing costs relative to the size of the grant. The number of publications. I worked with a faculty member here who was anticipating about 10 different publications off of an NIH grant. And at $3,000 to $4,000 a pop for APCs, it was completely unmanageable. And I'm actually not quite sure what they did for a solution in that case. Another thing that is going to be really important to keep an eye on in this context is that so far there has been a proposal in the federal government to put a cap on how much indirect costs can be, how much of a grant can be used for indirect costs. So whether that is hiring a grad student, buying equipment, facilities maintenance, or things like APCs, they are still talking about putting a 15% cap. So if you have a grant for $100,000, 15% really isn't that much money. And I think you would much rather be spending that towards the research than towards publication. That is not in place yet. but it might be coming. It's still being discussed and analyzed by different committees in the government. So that's something to keep an eye on. So what all of this means and what we're advising people here at UD is that you need to be a lot more strategic than perhaps you've had to be in the past when you've considered publishing your work. You really need to think about whether any of your co-authors are at institutions that have a transformative agreement. That means an agreement between the institution and a publisher that is paid for. The institution pays for this so that its researchers can publish at no or at a reduced cost. UD has some with Wiley, with Springer, a couple other places where our faculty don't have to pay APCs. So depending on where you want to publish, if you're working across institutions with researchers across institutions, you might contact your libraries and see what kind of transformative agreements there are. The issue with that, and we have run into this here at UD, is that a faculty member ran into this. They were the first author and they had already gone through peer review and they were like, oh wait, UD doesn't have a transformative agreement with this publisher, but my co-author does. And the publisher played hardball and said, you cannot change the first author at this point to take advantage of that fee or that break in cost. So the important thing is to strategize ahead of time. That might mean that in order to publish and save money, you might need to step back as a lead author on something in order to get that work out there. The other thing that you need to do is review the publisher policies of your target journals and see what publication models they have and what might be possible. Alexandra, I do see your raised hand and I will get to you in a moment. And do they have a publishing model that is going to work and allow you to meet the terms of the grant? And I hate to say this, but do you really need to publish in that journal? Are there other options that would be more affordable for you? And that is a whole nother question that is beyond my ability to address. For those of you at academic institutions with promotion and tenure processes, this is something to take up with your departments and with your faculty senate. Because there's definitely a lot of pressure to publish in certain journals. That is feeding into this, and publishers are aware of this, and they are taking advantage of this. Alexandra?
Hi, thank you so much. I'm one of the faculty members here at Nemours Children's Hospital. I guess I'm faculty at Jefferson. So clearly this is a very complicated situation. And I guess my question, and this might be more for the Nemours folks on the call, I would love to know who locally here I can go to just help me navigate all of this. Is it someone at Jefferson? Is it someone through um, the CTR? Is it someone locally at Nemours? Because I don't think I'm going to do this successfully on my own. And I'd like for someone to help me.
That's why we're fielding a lot of questions here at UD.
Yeah, and I can get back. So Sarah, I'll get back to that when Beth's done with the presentation. But there are resources available.
Awesome. Thank you.
Good to hear. I am going to show. I'm not used to sharing on Teams, so I'm wondering, can I click a link and go to the website and it's still going to work? Because in Zoom it doesn't. So one of the tools, this is an open access tool. It is run by a nonprofit organization in the UK called JISC, and they support academic research and education in the UK, but they have international coverage of journals, and they keep it really up to date. And so one of the things that they do is they provide all of the information about the different publishing options, and they provide direct, deep links into the publisher websites, which if you've tried to hunt through a publisher website on your own, trust me, those direct links are precious. So I just would like to click into it really quickly. Can people see that?
We can.
Yeah, okay. So I'm just going to do kind of a subject search instead of a specific journal search. And so what you'll see, and you can search for specific journals, obviously, but you'll see there's going to be all of these different journals, and we just click into this one. And what it's going to show you, and this is why I did dedicate a slide to the different stages of the manuscript: submitted, accepted, published, is if we look at accepted here in pediatrics in the American Academy of Pediatrics, they have a 12-month embargo. And so you can see right away that that option is not going to work, and you're going to have to look at some other. So like here, the second one here, there's no embargo here. So it kind of gives you an idea if you're shopping around to understand kind of the basics laid out in a very simple format. Unfortunately, these prerequisite funders, they only do that for the UK. They do not do that for the United States at this time. But you can, so these other options up here, like transitional agreement lookup, open access compliance, only apply to the UK. But it's still a really good tool because they do index internationally all the journals, and it will have this information, and it will have direct links to the publisher policy, so you don't have to go hunting through their websites. So this is, I just wanted to show this to you very briefly because it is a very helpful tool, I think. Oops, there we go. Where we move this bar. It's a super helpful tool. We use it here all the time to look up things when faculty approach us and ask us information, because it's much, much faster than combing through websites. So I do recommend playing around with that, taking a look at some journals that maybe you've published at before. But this is also where, once you have that information, going to the resources that you have locally available, whether that's a librarian or a committee or other group research support team at your institution, can be really helpful, where you can actually bring this information to them to kind of a leg up on starting that conversation. There are some strategies also for when you are submitting articles. So in the call out box on the side, this is direct language from the NIH that they recommend including in your submission, that this manuscript is subject to the public access policy, and that the NIH has been given a right to make this publicly available on PubMed. And so this statement right there is the thing that is causing so many problems with publishers. So I know that especially with a lot of the really big publishers, the submission process is so just like you're clicking on buttons. There's no way to have a back and forth. And so what you can do is you can include this language at the top of your manuscript if there's no other like notes section in your submission process. And I would encourage you to just put it directly on the manuscript regardless. I don't know how many of you have heard of SPARC, but SPARC is a nonprofit organization that works on open access policy. They have folks in Washington, D.C. And lobbyists trying to work on this, and they have put together a guide for authors for complying with these policies that's very helpful, and that they are keeping very much up to date. It just got published recently. They have monthly meetings. They are keeping on top of this. And there's also some information about author addendums. This is when you have a contract, a tool that can be used to assert to the publisher that you need to put a copy of this on PubMed. We haven't heard SPARC and Authors Alliance and other organizations who are involved in this work have not heard back from any researchers about whether they've had success using author addendums. So I need to add that caveat. We're not sure. This is also a good place to let you know that there have been incidences of researchers who have said, well, the NIH says that I need to put this up here and that they have a prior license, so I'm going to put it up on PubMed anyway, even though my contract with the publisher doesn't provide that. There has been varying responses to that by publishers. Most publishers have ignored it or have not followed up with it, but calling out American Chemical Society again, American Chemical Society is tracking people down and sending them bills who have tried that. That was reported out by Spark. That is information that they acquired recently from people. So I do recommend looking at the Spark guidance as well. Like I said, if you were able to make a copy of this, those are all live links in there that you can do. So yeah, there's also a bunch of links right in here to the policies, to Open Policy Finder, to the NIH policy FAQ, which is very, very helpful to look through, kind of breaks things down so it's not quite so overwhelming. And also a link to our guide to open access publishing, which has further information. And all of that information is something that anyone could use here. They do not need to be affiliated with UD to access it. All right, that was a lot in a very short period of time. It's very dense. I'm going to stop sharing my screen now. I think I stopped sharing my screen. How do I stop sharing my screen in here?
I don't see your screen anymore.